Freedomizer Radio, where freedomizers freedomize freedom.
So, I want to tell you guys that I posted on Facebook that I was going to be talking about this article. And there's a person who, because I stated in this, I am in favor of keeping this child alive. The work this family has been doing is heroic and is exposing the government's gun in healthcare. By standing their ground, this family is unveiling the corruption of our healthcare system. This exposure can help to rectify the third leading cause of death in the U.S., medical errors, and you are 40 times more likely to be killed by a deadly doc than a drunk driver. So one person responded and said, "Go, Tiger, go." I agree on this one. They put her there. They should let the family keep Jahi on life support. It would not be the first time someone came back from that diagnosis. Let the family contend with their catastrophic loss and grief. Through grief, let them make the decision when they are ready to let her go, if that is what God brings to their hearts. It's not rocket science, just normal compassion, something the world needs to hold on to. Compassion. There is a group you have to ask to join, and the group has, let me see how many people it has. It's got 230 members in it right now. I would like to see that grow, and it's called Harmed by Medical Error, Sharing Our Stories. And I posted that story, about, it was yesterday's story that I aired on Freedomizer Radio, which is about the rally and march for brain dead teen hospital calls already dead, CBS San Francisco. And so I kind of linked that to that group with this commentary. Okay, so the government judge appointed crony to check up on the killing of his crony docs, by his crony docs. Good for the family that they are demanding a real outside independent doc from Ohio. So one of the persons commented, he said, "The patient suffered unexpected complication. Are these efforts for real? People don't just become brain dead unless somebody made a mistake or even screwed up by being incompetent or reckless. Over 90% of medical errors are avoidable." And there's 5 likes on that. Another person said, "Agree with you, Ron. Over 90% of medical errors are avoidable, and not all of them are errors. Some are deliberate intent." You know, you guys, that gives me a chill because I know that is the truth. I know of sadistic doctors and sadistic nurses, and the next host, and I hope you stay put because next is going to be Cheryl, See the Power in You. She called me right before I ended my show the other day to tell me about what happened to her. At one point, she was creating a little bit of a ruckus in her hospital room, and to shut her up, a nurse came over and gave her something through her IV and knocked her out. And I know nurses that do that sort of thing, and it is downright criminal to do that, and yet they're getting away with it. So that's why I've been saying from the very beginning, the best thing you can do to get out of a hospital setting alive is make sure you assign a patient advocate, and be sure you know what the rules are in these hospital settings, because most of the hospitals have visiting hours, and after that, you're on your own. So as a nurse, I used to tell some of my patients, make sure you've got the phone with you if you are having an emergency and the nurse isn't or nobody's responding to you, because recently there was a report on mainstream media that it was taking an average of 18 minutes for nurses to answer call lights. So if somebody's having a heart attack and I says, here, get your phone, get an outside line, which usually is dialing 9 first, and then dial 911 and tell them you're in a hospital, what room number you're in, and tell them you're having a heart attack and no nurse is coming. And so watch what will happen. So those are some of the things that people ought to know how to do, what to do in order to get out of there safely. And I try to cover some things that you can do to get out of these hospital settings safely, because Newt Gingrich and others have talked about how 1 in every 3 patients that go into hospital settings are given more problems for which the hospital will then turn around and charge you to cure. So the next comment on this Facebook post is, after this lady talked about some are deliberate intent, is not only is a crony involved in this, they have the California State Department of Public Health investigating. They are so corrupt. This reeks to high heaven. See, these are some really awakened people. And another person replied to that and said, the California State Department of Public Health, the State Attorney General's office, the Coroner's office, you name it. If it's a California government agency, they are protecting wealthy hospitals and skilled nursing facilities. It would not at all be a stretch to say that in California, doctors, nurses, and administrators are government-protected, licensed serial killers. Indeed. Well said. The only thing I would add to that is that it is not isolated to California, folks. This is anywhere where healthcare is governed or is so highly regulated by any government. In Canada, for example, it has a communist style of healthcare, similar to the style of healthcare that King Obama wants over his subjects, we the sheeple, and that is that it is against the law in Canada to purchase health care. Unlike in the U.S. where you can actually purchase health care, I mean, good luck finding somebody to purchase it. It costs so much money because people have to jump through so many hoops because the medical establishment has a monopoly on it that it tries to bump out everybody that it can so that it can monopolize health care so that we the sheeple are beholden to just them and they can control the costs. So in a report that I covered a few weeks ago, I looked at some numbers of how many people are being killed by medical errors in Canada. And it didn't seem like a big number when you consider that 440,000 are being killed here. I don't remember what the number was, but it was like, I don't know, 20,000, 40,000 or whatever. Whatever that number was, I crunched the numbers and had my husband double check me because I'm not really great with numbers. But basically, you are 4 times more likely because of if you go make an apples-to-apples comparison based on per capita, you are 4 times more likely to be killed by a deadly doctor in Canada compared to the United States. So I guess what King Obama wants is to be the number 1 killer of people. Have the government have the medical institution be the number 1 killer, so that we can be the number 1 most exceptional country on the face of the planet, right? Oh my God! Another person commented, "That's what I call them too." Regarding, serial killers. He says, he says, that's what I call them too, along with murderers in white coats. And to think, once upon a time, I had complete trust and faith in them. That was before a group of them got together to trick me into totally unnecessary radical surgery by fabricating a number of non-existent problems, including non-existent cancer, and butchered me beyond repair for personal gain. This surgical racket has been allowed to go on for well over a century, and it's called, quote-unquote, standard medical practice. It is barbaric, archaic. My gosh, you guys, that is so true. And then I went on to say some of the stuff that I won't repeat myself because it's just my mantra. And then somebody else just made a comment, and I'll read it live. I haven't read it, but they said, Medicare and Medicaid and OSHA makes a bad mistake by notifying the nursing homes, hospitals, etc. a month in advance when they are going to be coming to their facility to do their inspections, and they look from top to bottom, in and out, because Medicare, Medicaid, and OSHA notifies them of the date they are coming. These healthcare facilities get prepared so that in case they are doing anything illegal or have done anything illegal, it's all covered up by the time Medicare, Medicaid, and OSHA gets there. I have seen this way too many times when I worked at the hospital. I worked as a CNA, and believe you me, that place got cleaned up really fast when they got through doing their investigations and such, and left for good till the following year. It went right back to the same way until I got them busted for leaving their med carts unlocked in the hallways. They found out that the DON, that means Director of Nursing, and our floor manager was stealing drugs out of the pharmacy. They were using the hospital as a cover-up for their drug deals and so forth. I know this is sort of off-key of of a subject above, but the hospitals and nursing homes are as guilty. Oh, my goodness. Thank you for that commentary. That is absolutely believable from my standpoint. I have seen shenanigans, and I absolutely know. OSHA's coming, Joint Commission, I forgot the acronym, Joint JCAHA or something, Joint Commission of Healthcare or whatever. It's a